what are some of the things that you've seen from the innovation side that are working or that are interesting to date?
Yeah, so it's fun to watch, and what I've found is, and this, I think this is just a universal truth, is there is best practice out there in every area, especially this area of innovation or AI or whatever you want to call it, across the globe. If we can just figure out how to leverage what's already been done, never mind what's being worked on, we could absolutely revolutionize healthcare. Even a few years ago, a good example, Jurong Hospital in Singapore went from a materials management department of hundreds of people to advanced robotics delivering almost everything in a department of a few people. Well, that just sounds like, well, we just replaced some people with robots. No, it's advanced AI based. Their materials costs are way down. Their shelf time is nearly perfect. Nurses and caregivers are saying that those are things they don't even worry about anymore. So we augmented the care process and improved it by doing that when one of our members there. Probably some of the most interesting things we've seen, obviously, is what I would call proactive security, and what we've discovered from a innovation perspective. And obviously there are countries like Israel that do this really, really well. Obviously they have to. They have a little bit different security requirement in their country than others. But when you talk to the security leaders that are there, where we talk about stuff of, well, we need to make sure we react to this, or we're monitoring really aggressively, their answer is, we need to catch 100% of everything coming in 100% of the time. And if necessary, fight back 100% of the time. Whether that becomes social profiling, whether that becomes some of the other things that are out there, where they're actually using social media and other things to figure out where attacks might be coming from to protect their patient base. And if you look at internationally now with GDPR and so many other things, the requirement, at least the perception of requirement, will be that organizations go from a pure defensive posture to now they're going to have to figure out how to proactively manage security in such a way that they're moving out ahead of their natural defenses to actually get out there and try to make sure they're protecting the organizations. Again, you could go on for example after example after example. What I love is some of the things that we're seeing in places like the UK, where they're figuring out how to use advanced analytics to help manage patients in what I would call one of the few places in the world that are truly doing it holistically. They've combined health and social care, what we would call mental health care, in such a way that the entire patient, the entire record, everything is being managed from a universal perspective. But not only that, they're proactively looking forward on how to use it from a preventive perspective. Again, they're using advanced analytics, technology, community engagement strategies, consumer strategies. We just don't see that, at least here domestically, quite yet.